There are several instances when bone grafting is necessary. First of all, if a patient has a tooth extracted or multiple teeth extracted and nothing is replaced into the tooth socket where the tooth was sitting, eventually our body will start to remold that bone to a much smaller and thinner ridge. Second of all, patients can come after years of having missing teeth. In those cases, the bone is remodeled to a point where it is much thinner than it used to be. You can always see an example of older patients that wear full upper and lower dentures. When they take their dentures out, we can see how their jaws are really resorbed and their lips sometimes fall in. That's due to bone resorption. Bone grafting is a process by which we can regenerate or restore lost bone or possibly prevent bone from being lost by placing bone products into the tooth extraction site at the time of the tooth extraction or sometimes after the tooth extraction to rebuild some of the bone that's been lost in preparation for use for that area for dental implant placement. Bone grafting procedures in general are very similar to having a tooth removed, sometimes even much less involved. Basically, you can expect to have some sutures in the area. You might expect a couple of days of soreness and discomfort, and subsequently the area will feel like regular gum or regular area where there has not been a tooth. There's very minimal discomfort post-operatively, and most patients do very well. Well, first of all, BMP stands for bone morphogenic protein, and that's a technique that has currently come into favor. I was one of the developers of the technique and have studied it intensely. Bone morphogenic protein involves the use of actual protein that stimulates our bone cells to regrow bone in areas where it was missing and in areas that have been very difficult to grow in the past. Traditional bone grafting involves a process by which a patient comes in, they may need a tooth removed, their tooth is extracted, and subsequently bone material, either synthetic or cadaver which has been sterilized and processed, is placed into the site where the tooth was. This then is covered by a coating called a membrane, and it is suture closed using a resorbable suture, and it's allowed to heal for a period of 3 to 4 months. Eventually, the bone graft material which was placed will be turned over into the patient's own bone, thus allowing us to have a nice structure, a nice wide ridge for placement of dental implants. Bone morphogenic protein is slightly more involved, where we reserve that for areas of large bone loss, usually upper jaw or lower jaw, where large sections of bone are missing. It is a recombinant protein, so it's a chemical that's placed on a special material called a collagen carrier, mixed with bone graft material and placed into the area where we would like to have advanced bone grafting. This is then closed over with resorbable sutures, and the patient waits between 4 and 6 months until the area is ready. It is re-evaluated using our in-office CAT scan, which gives us exact dimensions of height and width, and we can determine prior to surgery whether or not the patient has had adequate bone healing and bone volume for implant placement. The usual waiting period from a traditional bone graft after an extraction is approximately 4 months. There are cases where we can do simultaneous extraction of a tooth, placement of a dental implant if sufficient base bone or patient's own bone is available, and do a bone graft at the same time, filling in slight voids that may be necessary. That usually requires between 3 and 4 months of waiting. If BMP or bone morphogenic protein is used, I usually like to wait about 6 months for proper healing to allow enough of the patient's own bone to be formed to be comfortable that it will be able to support dental implants.